Hi FreeBody Massage family, Kat Matlock here in Asheville, North Carolina. This video is going to give you specific trigger point therapy techniques for working with levator scapula. I highly recommend that you watch the anatomy video that I posted a week or so ago with anatomy of levator scapula and trapezius. Those muscles often work well together and really like to be worked in the same session. So you've already got some great trapezius work with your client supine. So I'm going to drop a link to the anatomy video and also a link to that trapezius work in the description for this video. So in this video, I'm going to show you levator scapula. I want to talk to you just for a quick moment about why it's so important to know good work for this muscle. So levator scapula, as we know, goes from that upper corner of the scapula and comes up and grabs the sides of the vertebra in the neck. This muscle freaks out with everybody texting all day long. If you're looking down and texting all day long, that muscle's hanging onto your neck, trying to pull your head back over your body. So this is straining levator scapula all the time. And who doesn't do that? All of our clients are doing that. We're doing that. And we're all wreaking havoc on our levator scapula. It can cause aching in the neck, and that ache just like at that bottom corner of the neck where it starts merging into the shoulders. So this work is going to help every single one of your clients to feel better. So let's get started. Levator scapula. All right, working in levator scapula. Who doesn't love this work? Right? Everyone, seems like everyone on the table needs this work, right? Levator scapula. And I can feel her left one is chunky. See that? You can go clunk, 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 clunk. Like her right side, no problem. Nice and smooth. You know, there's always a little bit of thickness at that top, near that attachment. But this one, there's just no give. It's kind of like clunk, 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 clunk. And so I like to do some nice glides with my ulna, because really that ulna can really get in there. Does that feel nice? Yeah, she likes it. So we're going to keep doing it for a little bit and warming up our levator. So as I mentioned in the anatomy section and the trigger point pain referral discussion, that levator scapula really responsible for just that ache that a lot of folks show up with right at the intersection of the shoulder and the neck. Levator scapula has two main trigger points that we can work with. And again, it's a deep muscle. We've got lots of layers of things on it and around it. What else do we have up here? We have rhomboideus major and minor, right? Rhomboideus minor at the top and major at the bottom, going down about 2/3 of the way down the scapula, and then like a chevron on each side coming up. And then levator following that spine of the scapula and along that curve. So we have the spine of the scapula, we have the supraspinous fossa, supraspinatus living inside that, and then along that curve is our levator scapula. So this muscle is subject to poor posture, hiking up the shoulders, because it elevates the scapula, right? Levator scapula. Also, if someone has a tendency to hang their head forward, because one of its main jobs is to resist forward head posture. So you want to keep that head pulled back so that levator scapula isn't just hanging on for dear life. So we're going to find 2 points in each side. So we find the spine of the scapula, come over across the supraspinous fossa, and find that deeper corner, that deeper superior angle of the scapula, superomedial. And then right off of that is where we find our levator scapula point. Now you can use a stacked thumb. Remember, you're 90 degrees to the tissue. So you can play with angle. So I like to get down on it, you know, right in there. And then soften my knees so that I can push off my back leg and get right in there. How's that pressure there, Jennifer?
It feels good.
Would you like more, or would you like me to try a different angle?
Maybe try more.
Okay. And then, so I'm going to get a little lower. Notice I'm bracing my elbow against my body so that I can press in that direction. How's that feel?
Feels good.
Okay. And so I just want to check and see if I come up a little bit and angle this way, how's that spot?
It feels good.
Okay. I just want to make sure I'm not in the rhomboid. It's hard to tell. Levator is a little deeper. So I actually think that I kind of came off that levator and went into her rhomboid. So I'm going to go back down again. And as I'm angling to toward the scapula and toward her feet. Now I'm going to do this side with my thumb. I'm going to do this side with my elbow. Maybe I want to do this side with my elbow because she's got more tension on this side. So I'm going to glide off of that. Get down. And I'm going to step my feet back. My back knee is bent. My back heel is lifted up off the floor because that's what's going to drive my pressure in my elbow. So I'm going to get my elbow point down in that spot, right at that levator. And then I'm going to keep my elbow bent and push in with my legs. How's that?
It feels good.
Okay. Does anything not feel good?
It all feels
Whoop.
good.
It all feels good. What? And then I like to drop the hand, glide down. All right, so we're just trying to get into that corner. And then the second point is above, slightly medial, very slightly medial. And it's above where we were, so caudal, up toward the head. And I'm going to actually slide her arm down a little bit. That's going to pull that tissue a little more taut. Actually, most of the time I work with the tissue slack. For levator, I like to pull it a little bit taut. It makes it pop a little bit more, makes it a little bit easier for me to find that point. For the second point in the levator, we slide caudal up toward the head a little bit and in just a little bit. I'm near the transverse process where I was with my thumb underneath there, but not quite. I'm still a little bit more lateral than that, just to try to give you some reference of where this is. And remembering that that levator comes up and twists and then attaches along the transverse processes. So we just ride up. We know levator is headed up to these transverse processes. We're slightly lateral to the transverse process, so we're near but not right on it. And then we're looking for a tissue that's coming up from that corner and doing its little twist. And then if we want to palpate and just, so what else is back here? We've got posterior scalenes. So we might have some rhomboids depending on where your thumb is. So what I like to do is get my thumb in there, and then we see if we can palpate it by having the client push. So I'd like you to put, yep, there you go, and back down. So don't try to push me over, a little bit less. There we go, there, that's it. And we can feel that tightened up, right? Yes, trapezius is going to tighten up also, but trapezius is very superficial. So the levator is deeper in there, and that's what I felt. I could feel that deeper tissue. So now I'm coming up, I got down on one knee, And I'm going to bring this table down a little bit because I can, so that my arms aren't quite so high up. And I'm just down on one knee. I like to do that because then I just can get into a lunge. You could put a blanket underneath your knee for some support, and then angle right in toward, it's almost toward the opposite hip, really. It's a little bit diagonal. And how does that pressure feel to you?
It feels good.
Okay. Do you want more or less?
I think it's good.
Okay. And because she has some tension here, we're going to hold, give her some time to breathe, give her levator an opportunity to get the point that we want to release the point. We want to let this muscle soften. We just want to give it that chance to do so. So we're going through upper trapezius. So it's always good to release the trapezius before releasing the levator. See how that. Do our soothing, gliding that ulna up, elbow down, ulna up, elbow down. Nice. And that levator has lost a little bit of that excess tone. Not quite as chunky, still a little bit thick, but not nearly what it was before. And so now we're going to go ahead and do some release work of the levator on this right side. So much smoother and softer this right side is. And then I want to find the spine of the scapula, because then I know that if I follow it to the corner where the spine of the scapula ends, just above that is that supraspinous fossa, where the supraspinatus lives. My thumb can just strum across that. And then if I come off of that, right in that corner, that's where our levator is. So spine of the scapula, supraspinous fossa, and then down off the shoulder blade into the levator. And we can ask our friend to press up into my hand a little bit to activate that. And we're going to feel that deeper in. There we go. Slide it down a little bit, please. And we're just going to do this 1, 2, right here in the levator. Angle ourselves 90 degrees to the tissue. Lean in with my body, coming into with my lunge. Making sure that my shoulder feels good. My body feels good. I might come back out of it. There we go. This side is so much more amenable to, it's like, okay, I will get softer, no problem. Great. And then from there, our second point, we come a little more medial in that kind of thick line of that levator coming up and twisting. We're not quite all the way to those transverse processes. We're still a little lateral of those. And we're going to angle in a little bit more toward the opposite hip. And let her take a few breaths. And do some soothing. I like to come across the body and just drag my fingers over traps and levator. Now she's still a little chunky there. Some of that is rhomboids, and some of that is that I can feel that she has some scalenes tension here. We know that the scalenes stabilize the cervical spine, but they also tilt the head toward the shoulder. So the scalenes are part of the culprit of what's creating this. So it's not ever just one muscle. Sometimes when a muscle can't fully release or still feels thick after you work it, it's because there are other tissues in the system that are still holding their tension. In this case, I can feel some of those other tissues are her left side scalenes, much more bundly than her right side. So I would continue this treatment with her by working and releasing her scalenes. But that is releasing levator scapula, 2 major points in levator scapula.